Silverman, and I'm a well-being specialist at the Mounds View, Minnesota office. And today I'm so excited. We have Esther, um, who's a physician assistant at the Mounds View Well at Work clinic. And then we have Leslie, who's a registered dietitian through Bon Appetit. She's joining us from Kansas City. And together, I just thought it would be a great way to join this topic, kind of seeing what Esther sees in deficiencies when she has some patients, things she might see. And then Leslie having that nutrition background of like what foods or what supplements do you recommend? So to get us started, I think I'll just get you going, Esther, and then you can ping pong off each other and however it flows. But what, like with supplements, do you see any deficiencies, any kind of general ones or most common occurring ones?
Yeah, I can say as of right now, the most popular deficiency would be that I see would be vitamin D. And just because of where we are, nobody's really outside during a time frame where we're supposed to be in the sun and get our vitamin D. So that's the most common deficiency. And so at this point, even if we go back to testing, from coverage to insurance, they really just want to make sure everybody is supposed to be on some sort of vitamin D supplementation because most people are going to come back deficient when we test on that. So that's a very popular one. The next deficiency would be maybe more towards women in particular who are bleeding heavily during their periods would be iron. So I would say iron and vitamin D. The other deficiencies that come are also very dependent for most healthy adults who are getting everything, eating a well-rounded, balanced meal tend to be okay, especially the B12 and B complex. But there are a subset of people like, vegans or vegetarians, they might be low on the B12 as well. So that's another deficiency that I do see in the clinic. Then there are other people with other medical conditions that predisposes them to being deficient. And typically it's things like people with malabsorption problem, like whether it's celiac or Crohn's disease or short bowel, and then some people with surgeries, like if you had what we call it stomach-tide, people just don't absorb, especially the B12 very well, or they've had the bariatric surgery, so they have to be supplemented, and sometimes it has to be an injectable versus the oral because of the absorption issue. So those are the most common one. There are other people on medications that can delay or affect the absorption level, so they might still be taking supplements, but the body is not taking it because of some medications that the person is on. But overall, I would say it's vitamin D, iron in women mostly, and then the B12, B complex in the vegans or vegetarians. And those are the most popular ones that I do see in the clinic.
Yeah, I would agree that most individuals here, especially in the Midwest, are deficient in vitamin D. That's something that you would want to get verified from blood test, as Esther was talking about. That's not something that you want to just start taking a vitamin D supplement. When we're talking about supplementation, it is something that you want to consider with the guidance of a medical practitioner. That's something that you're going to see supplements be heavily touted in a lot of social media outlets and just like from a lot of like influence that's out there. And there's a lot of dangers to that because when you are talking about supplements, they are in a lot of ways something that could do more harm than good. So it's, for example, something like vitamin D. Vitamin D is one of our fat-soluble vitamins, meaning that there is a threshold in which you can take too much to where it could actually do harm to your body. And so you would want to verify that you are deficient and then from a blood test and work through your doctor in verifying that. And then you would want to then work with a medical team in order to know how much vitamin D to then take in order to become, to get your levels back up to where they need to be, and then what the plan is for you to remain at the adequate level. So Vitamin D, though, is one that it is very common to see individuals be deficient in. B12, definitely within a vegan and vegetarian population. I've been seeing a lot within the chat, and there's a lot of talk now amongst individuals, especially within an active population, about creatine. Creatine is one of those supplements that is something that can be beneficial in helping with exercise and kind of promoting the ability for the muscle to do work. There's also a lot of studies that are coming out now in tying it to brain health as far as like memory and like areas of like dementia and whatnot. So there's a lot of like really promising studies around creatine. But again, that's something that some individuals, like, you may not be getting enough creatine from your diet. Creatine comes in the form of red meat. So if you don't eat a lot of red meat, you may be deficient. You also probably aren't getting enough even from eating enough like red meat if you are. So that might be something that's beneficial as well.
Thank you. Some people are asking too, like, how long before you start seeing levels start to even out when you're starting supplements? And like, should you lower consumption, like your dietary consumption if you're taking supplements? Like, how is it? How do you feel like real food, whole foods versus supplementation and kind of the process to that?
Yeah. So
I will always go for the real food
same.
first.
Good
Yeah.
idea.
Yeah.
I will always go for the
real
real
food.
food
Yeah.
because, at least it's not, well, that's another topic, but when we talk about processed, right? So the whole food versus actually processed food, like if you can eat a whole apple versus, what is it, the canned versions of, apples or mangoes, if you can get them whole, that's the best source because the human body, I believe, is made to be eating. That's how you get our supplementation from. So I would always choose whole food over supplementation with the over-the-counter stuff.
Mm-hmm. Yeah, I mean, the benefit of eating to get your nutrition from all the different vitamins and minerals and nutrients that come from whole food certainly is superior to supplementation. I mean, just by definition, the word supplementation means to, give the body, in this case, back something that it can otherwise not obtain through the diet or otherwise. So it's where, again, working with your medical team to say, is it possible for you to get what is necessary through the diet? If the answer is an absolute no, then sometimes supplementation is the answer. So, like, for example, for someone who's had bariatric surgery where there has been a change to their physiology and they're not actually able to absorb certain nutrients, they have to supplement because they're not physically able to otherwise. And so supplementation is necessary. For a lot of people, supplementation is unnecessary, and they could benefit from, working with a healthcare provider, maybe a dietitian or otherwise, or maybe it's, something I'm seeing a lot of like information in the chat and questions in the chat about like the benefits of supplementation for sleep. Sometimes sleep isn't necessarily about like having a supplement. It's working with someone to develop good sleep habits and, having like a good sleep regimen and whatnot. So it's kind of checking all those boxes first and then looking at whether supplementation is a good option.
And then with that, like with supplementation, does like the form it comes in make a big difference, like gummy versus pill or liquid, like the absorption?
For some yes and some not. I mean, everyone's a little different. If there's a difference, I want to say it's probably marginal. I think really when it comes down to form, and this is, I guess, my opinion and how, if I am working with someone and talking to them about a supplement, it's what form helps you take it most consistently. So if taking a chewy gummy multivitamin makes the most sense for them because of taste and form, then let's go down that route. It's sometimes just like when it does come to supplementation, consistency is what matters. So that trumps over form. That's my take at it. I don't know, Esther, if you have a different perspective.
No, I think consistency is the key. So, if somebody's going to be taking supplementation, they need to be taking the form that they know they can tolerate. There are people who are also sensitive to whatever binding agents that are used in the capsule forms or pill forms. So some people might be better with either a powder form or a liquid form, and it just depends on the individual. So not one type of formulation is across board best for everyone. It's just really individual based. And I do know that a lot of people can be sensitive, and whereas they might be taking something for the supplementation, and then now they're getting joint pain and discomfort because there is something else that has been used to bind those the vitamins. So that's the only thing I do tell people is just keep an eye on those things. If you feel like you're sensitive, you might do better with not a capsule, but maybe a pill versus or a chewy, and because it has less of those binding agents in it too. So, and then of course it depends on the quality of vitamin that you're getting, whether you're getting what is actually on the bottle or whether you're getting less of it. And for the most part, I do tell people you just have to make sure that it's third-party certified or CMP or GMP certified, to make sure that maybe you're getting the best that you could get when you're dealing with the vitamins.
Really good
Esther,
point.
do you know or like experience what are some vitamins or minerals that are dangerous if you overdose on a certain vitamin? Is there anything that's pretty dangerous or common of overdosing on? Can you take too much of something?
You can. I break it down to two forms. So there is water soluble vitamins and fat soluble vitamins, right? The water soluble vitamins, rarely do they cause a problem if you take too much of it. You have to take like literally so much that your body can no longer do anything with it. The ones that are worrisome for possible overdose are the fat soluble vitamins. So that would include A, vitamin D, vitamin E, and vitamin K. And those are ones that people can overdose on that. So it's best to follow kind of whatever recommended dosing that you've been given or what's on the bottle versus taking a lot more than instructed to. There are a few other supplements that can sometimes become a problem, especially things that you can think of it this way. There is the natural form and then there is the medication form, right? The prescription form. They are pretty much similar. So sometimes I tell people just because it's a vitamin does not mean that it can cause, and one of the common one would be something like kava, and then there's the newest one I think I've been hearing now is kraton, or crate if I'm saying it right, Kraton, and people can have liver injuries from taking too much of those two because it's processed by the liver. So there are some vitamins that if it's heavily processed by the liver and you take too much of it, it will end up turning bad for you versus beneficial for you.
There are others like, to consider, things that are outside of just like single supplements. So things like electrolytes, for example. Electrolyte supplementation is really popular. Electrolytes for just regular individuals, supplementation actually isn't recommended. So like electrolyte supplementation, like taking liquid IV, things like that on just like a day-to-day basis isn't necessary. You're getting all of the various electrolytes, hopefully through the diet, you're getting sodium, potassium, chloride from the diet, and so taking electrolytes is not necessary. So there's actually been cases of individuals taking multiple liquid IVs in a day and then throwing their body's electrolyte balance out of whack, and then that causes issues. So even those, when we talk about things like that, you can do a lot of harm because those are still considered supplements, things like that.
And then I know you've talked about third-party certification, what to look for. What about things to avoid when buying supplements? Like something that would be maybe be a red flag or that you just shouldn't trust or maybe be skeptical of?
I'm sure there's a long list. I can't just say it off the top of my head. I would say unless you've been told that you specifically need that, you stick with the main vitamins, right? So all the water soluble vitamin A, B, C, D, E. Stick with that. There's niacin, riboflavin, there's biotin. Stick with the common ones, right? Now, if you start seeing a name that looks so unfamiliar to you, that doesn't come up day to day on the vitamin list, you probably should be avoiding that. That's kind of the way I explain it because there is so much. And then there is also, depending on where things are made, there could be cross contamination with other things or other things that were not meant to be in there but happen to be in there. So they could also not be listed on the bottle, but you're still getting it in your system. So I would stick with the main common ones that we're pretty much aware of. The water soluble ones, which is typical for people who be the vitamin C, B. I know zinc is also water soluble. Riboflavin is, so you can stick with those and then do the fat soluble ones, but avoid the ones that are noted for treating specific conditions unless there's been a lot of research behind it, right? I can say it's something like turmeric and stuff. It's in my world, we always say conflicting evidence, though it still works for a lot of people. So I don't dissuade people from taking it because there is some anti-inflammatory properties to it. Another one that a lot of people would take for joints would be glucosamine chondroitin. There is still, in my world, it says conflicting evidence, but I do know but we don't dissuade people from taking it because there are people who actually feel better when they take them, when they're on it. So it's with vitamins, unless you have a specific condition that a provider is telling you to take, that it gets tricky to what should I be taking? Should I be taking CoQ10? Should I be taking ashwagandha? It's like we wouldn't know.
Yeah,
There's not a
it's almost
straight answer for
better.
that.
Yeah, it's almost better to err on the side of that supplements may be the last resort. Because when it does come to supplements, so like looking for first, I guess, like looking when you are looking for a supplement, if it is just, one individual one, you want to look for ones that are, USP verified and like have that a third party certification. When purchasing them, if you can purchase them, or my strong recommendation is to purchase them directly from like a pharmacy would be best versus buying them from like on online vendor or from like an influencer or something like that. Buying them, avoid buying them from like an Amazon or something or a third party type of purchasing, because there have been cases where the supplements aren't the true supplement that you're getting, though they may look like the label. Someone may have altered that label. It's a scary place for those things, for the supplement kind of world. So buying it straight from a pharmacy is going to be like the safest way for you to go when it comes to supplements and supplements that you're purchasing. But yeah, and looking at also and recognizing that the supplements are something that you should consider a part of your medication list. So when you are like writing through your medications and reporting them to any healthcare provider, they should be something that's included because they can contradict each other. They can contradict any medications you're taking. They can contradict any, procedures you're undertaking. Like, for example, if you're taking fish oil and you're about to undergo surgery, or, there are certain supplements also that have, blood thinning properties and you're about to undergo surgery. If they don't know you're taking those, that can harm you during surgery. So, just remember that all of these things do have have impact on your body, and kind of treat them in that way. And so, if you can think about them in that way and say, are there things that I can address within my health in a different way through nutrition, through exercise, through movement, through other, different areas of lifestyle change versus the supplement route. Sometimes it's better holistically, even for like the whole body, to go the first route versus supplement for safety and overall health.
Thank
Yeah,
you.
I definitely agree with. I was going to mention that too. You have to give us you have to give the list of the vitamins that you're taking. It's so important. So keep that in mind when I know we don't always do a very good job of specifying when we're asking about medications, but vitamins are considered medications too. So definitely list those too when you're seeing your provider.
And Esther, do you do blood tests for deficiencies? Like, is that a common thing people could ask for? Somebody was asking an expensive way to find out what vitamins they should be taking.
So with the world of vitamins now, our biggest problem is actually insurance when we do these labs, right? Because there is so much out there and everybody's getting these labs done, and insurance is they're the ones fighting. So it's really hard for providers to just order every vitamin that you're thinking of. Now, the most common ones that I do screen for would be the vitamin D, though it's a similar situation with insurance. I'll always get a flag that says the patient might get a bill for this because insurance doesn't cover. Unless they have another medical condition that requires the vitamin D level to be known, such as maybe osteoporosis or especially some people on the weight loss medications too, like Wegovy, somebody who has had gastric bypass. There's certain conditions you can get away, then they'll cover if there's something, if it's a reason why you're checking it versus just wanting to know that your D levels are high. I do order B12 and complex too. Actually, I don't do the complex as much. It's typically the folate and B12, and that's mostly for people who are on the vegetarian or vegan diet. Um, Rarely do I find people with a calcium issue, so that is typically not a very common thing we order. But the biggest ones I would say is vitamin D if we have to, and then the B12, and then folate. And then other big one would be for the women, it's the iron. And typically I'll do iron, but I'll also do the storage iron because sometimes people are normal, their hemoglobin, which is what we're looking at for the iron, is normal, but their storage is super low and they will still not feel good when it's that low. So I always check the storage and then I explain to people, well, most people feel better if you're 50 or above. If you're lower than that, you probably might not still feel the greatest, even though the hemoglobin is normal. So those are most common ones that I would do in the clinic.
Thank you. There's a lot of questions. Sorry, I'm not probably going to be able to get through everyone, but also there was just one recently, and since we're coming upon flu season, is it helpful to take like vitamin C, zinc during flu season, or is it a waste of money?
Well, one reason to take vitamin D during the flu season is because we are not going to be outside to get our vitamin D supplementation, and most of us don't even get enough through the foods that we're eating. So for that purpose, I would say yes. There has been some studies that have shown that vitamin D can also help with recovering or illness when people are, or if they do it with a combination of like vitamin C or zinc, that it can help. It's not a cure, but it can boost your immune system to be able to fight things up better. So if you're going to take vitamin D in the flu season, I'd say yes, because it's that time of the year where everybody's going to start depleting their sources of vitamin D. And then second, although there has been some studies that seem to show that it helps with the immune system.
Thanks. And as you're looking through, Leslie, Esther, if there's something that you saw in the chat that you wanted to, that kind of got your attention and you're interested in. Another one was like the timing of taking supplements, like taking them all at once or certain times of the day better.
think it depends on the supplement. There are some supplements that um do follow, like, and it'll say there should be directions on the bottle to let you know how to take it, because sometimes it comes down to taking it with food. And so like something, for example, like a fat soluble vitamin, like by definition it is best soluble and best taken with the presence of fat, and so you would want to take it with a meal, particularly a meal that has fat in it. So there's things like that. There are just sometimes just like preference in which times like people will take a food or take a supplement. A lot of times though, and I don't want to say again, this isn't blanket all supplements, but it does come down to consistency. So, a lot of times people will talk about how a supplement didn't work for them and, whatnot, or they're not really seeing like any kind of results in some way. And sometimes it comes down to it's the consistency factor, and giving the supplement enough time as well, in those. So those two together.
Yeah.
And
Yeah,
Leslie,
timing is there are certain vitamins, and if, like she said, if it's very specific, it should let you know on the bottle that you're supposed to take it with. The one other thing I tell people is some people tend to get upset stomach or not feel good when they take vitamins. Um, and some people have actually reported that they can't sleep. It took a while for them to figure out that it was actually the vitamin that they were taking at bedtime so that they don't feel, they're not experiencing the queasiness from it, but at the same time, it might have had niacin in it or B12, so it's giving them energy instead of trying to make them fall asleep. So um, it's really about the individual keeping an eye on, what are you feeling when you take this vitamin? If you take it at night, does it seem to affect you differently? Or if you take it in the morning, is it affecting you differently? And ideally, most people feel better if they take the vitamins with food. And then, of course, there is, other things like you taking it with milk, and what does milk, you know, what is the interaction with vitamin C and iron and all of those things. So it gets a little bit complicated knowing exactly when to take or what not to take with what. If it's a multivitamin that has all these things in it, we are just assuming you can take all of that one pill that has everything in it together that way. So that's that. And then I see, what was the one? Oh, the iron. When it comes to iron supplementation, I see a question similar to when it comes to iron supplementation, we're starting to move away from people taking iron daily because a lot of studies have shown that you're not getting any more taking it daily. You can actually do better taking it every other day. And then of course, it also depends on the formulation that people are using. We like liquid because people can absorb it a lot easier, but then it can cause staining of the teeth, and people don't like that either. There are some formulations of iron that seem to be better tolerated than others, and sometimes people just have to try it. But for the iron, it's not necessary to be taking every day because your body only takes so much to take it, and if you keep taking it every day, based on the studies that have been recent, it's not needed. So I'll tell people just do Monday, Wednesdays, and Fridays, for instance. Those are your iron days. So.
And how do you feel about supplements for joint health, like glucosamine, the chondroitin, or collagen peptides? I think like just as an aging population, we're all aging. Somebody had asked earlier about it, and I said I would touch on that. So do you have any thoughts on joint health?
I think I did mention it earlier, like maybe very briefly on the glucosamine. So in my world, when we say Western medicine, right, the studies are not very conclusive that they do help. But we've also, based on studies, a lot of people do get benefit from it, actually physically feel better on it or physically feel like it's helping your joints. In that case, you can take it, right? It boils down to just make sure it's third-party certified, and you're getting a good quality vitamin. But we do not dissuade people from taking glucosamine for joints if it helps them. They can keep taking that. That makes sense. And then turmeric was the other one too that is in our journals for anti-inflammatory and helpful. So if you're getting it from a good source and we don't consider it harmful and you're not overdoing it, you can, but it helps you when you take it, you can take it.
Yeah, that's it. And I think like it's important to know with a lot of those like supplements, a lot of their indication for help, like in what they're helping, are the same. They have a lot of overlap. So in helping with something like with arthritis or just general joint health, like really what they come down to is helping with inflammation. So you know, taking those two supplements or one of those supplements um in part of a general healthy diet, an anti-inflammatory diet, as well as maybe, you know, working with like someone within the Medtronic team and like within strength training and something that helps like with like the proper like type of movement and whatnot. They all are tools in the toolbox in order to build overall an anti-inflammatory kind of system. So it's not going to be just one thing necessarily that kind of solves it all. Like they're all kind of tools that help promote a healthy system.
Yeah.
Totally.
Well, unfortunately, we're down to time. I want to thank you both so much. I know we could be talking about this all day. It's very, very interesting topic, and we really appreciate your time, Esther and Leslie. If there's just one last sound that you want to give or piece of advice overall on supplements, feel free to share that before we go.
Esther, I'll let you go first.
Oh, just concluding comment.
Yeah.
So this is what I have to say. When you're taking a supplement, always ask yourself, why am I taking the supplement? Is it because I'm not getting it from my diet, or is it because I heard it's good for something and I'm taking it, even though I don't know if I should be taking it? So always ask yourself, is there a good reason why you're supplementing, and not just taking it because there's a lot of talk about it. And so that's how people end up with so many vitamins, and it's pretty overwhelming, the amount of vitamins people can take together. So always ask yourself that question first. Also always buy third-party certified good quality vitamins if you're going to do that, because it does make a difference, because those ones are also the ones that would likely not have other trace things in there that are not supposed to be in there. And so good quality multivitamins. And then, just like we said from the beginning, always let whole food sources be where you're getting your nutrition or vitamins from. And then, of course, you can always supplement if you feel like you're not getting it all from the natural foods.
Yes, I echo all those things. All of those things are what I would say too, that, you know, looking at the overall picture of your health, and that, you know, a lot of people do think that supplements are necessary, and it's actually the inverse. Supplements are supplements. They are there to supplement something that is otherwise not possible for you to get otherwise. And if you look at it in that way, and look at it in a way that there are alternatives, sometimes more fun alternatives, less expensive alternatives to help you, you know, feel better, you know, whatever maybe your health goal is, then it can help with kind of the overwhelm that can come with supplementation. And then, you know, if you do choose for your health to choose supplements, if that is something that you go down, you know, work with a healthcare professional. Healthcare professionals work very, very hard in order to keep you safe, and study very, very hard and bring you the evidence that is necessary to keep you safe. And there's a lot of misinformation that's out there around a lot of topics, and supplements is a big one. And so I would say that the last thing that I would give to you is, within the topic of supplementation, is to go about using them from the guidance of someone who has the education behind it, and can keep you safe in your journey of using that supplement.
Great. Well, thank you both so much. And thank you to everyone for joining in today. It's always an interesting topic, and I always enjoy working with Leslie and Esther. So thank you, everyone. Have a great afternoon, the rest of your day.
All right. Thank you.
Thank you, everyone.